In Chapter 25, we will be going over preventing and managing injuries in young athletes. First, we'll discuss cultural trends with youth sports. So first of all, we've had a significant increase in participation by young children in sports, particularly more in the last couple decades with girls versus in previous times. And this includes organized and informal sports and recreation activities. Organized sports, I think, have been the biggest push, though. A lot of kids are involved in a lot of different organized sports. My son is currently involved in 3 different organized sports, and he's 5. As far as how that affects sports injuries, we've had an increase in sports and recreational related injuries with younger kids because of the increased participation. They just have more exposures. And the risk of injuries is inherent in sports, but especially for young athletes, because they're still gaining motor skills and cognitive skills, they have a special likelihood of getting hurt. Thankfully, with the littles, most of the time they don't get hurt that badly, but with the older kids who are starting to get better at their sport but still not super coordinated, they'll definitely get some of the same injuries as adults. As far as appropriateness of youth participation in sports, we want to kind of look at level of training and intensity and frequency. That can be a concern. I have a girlfriend whose 7-year-old son has played almost year-round baseball since he was 5. I personally think it's too much. I think it's too much for their family. He's the oldest of 3. I also think it's too much, kind of in some ways too much for the kiddo. I mean, one night they were at the baseball field till 9:30 and he was 6. It was just too much, and he's not even doing travel ball. So I think that, with certain sports, like for us, my husband and I have actually specifically made the decision not to let our son play baseball because of watching their experience, because we'd rather have him have fun playing a lot of other sports than just have to do the one sport all the time. I love this picture of this little kid. He looks so sad with his basketball and his sling. He just wants to go play. But as far as childhood athletic injuries go, about 3.5 million children ages 14 and under will suffer medically treated sports injuries every year. Nearly 75% of U.S. households with school-aged children have at least one child who plays organized sports. So again, that's just going to put the children at a higher risk because they're going to have more exposures. Collision and contact sports will have higher injury rates. So sports like rugby and football are going to have some of the highest injury rates. Hockey and lacrosse would be probably next. And volleyball would be one of the lowest injury rates as far as traditional sports that kids usually play. Our most common injuries include sprains, muscle strains, bone and growth plate injuries, heat illnesses, and repetitive motion injuries. So a lot of these injuries are going to be similar to adults, with the exception of the growth plate injuries would be especially for kids. About half of all traumatic brain and head injuries in children occur in sports and recreational activities. The really sad part is that means that most of the rest of the half are probably inflicted by caregivers or accidents. But most organized sport-related injuries, about 62%, occur during practices rather than games. So as an athletic trainer, I've spent a lot of time covering sport games for high schools, especially if the high school couldn't, quote-unquote, afford an athletic trainer full-time or even part-time. But the thing is that over half of the injuries are actually occurring in practice anyways. So we're missing a significant portion of the injuries there if we're only having sports medicine coverage for games, unfortunately. Some proven interventions to help prevent injuries would be that children should have access and consistently use appropriate gear for their respective sports. Coaches should not allow kids to play a sport that requires a mouth guard until they put their mouth guard in. They shouldn't allow a child to play hockey if they forgot their coccyx pad or something. They need to be using the equipment that they're supposed to be using to keep their bodies safe. Children enrolled in organized sports that are properly supervised and run really helps. So making sure that there's an emphasis on injury prevention and reduction as far as following the rules and just being respectful, I think is really important. Coaches should be trained in CPR and first aid, and they should also have an emergency action plan in place for the venue or for that team at least. Having a certified athletic trainer on staff is ideal due to our training in injury prevention and injury care, although for recreational sports that's not always an option. Sometimes teams get lucky and they have a parent who's a doctor and they want to help, but not always. So a lot of lower level or recreational sports go unsupervised by a medical professional, which is why coaches need to be CPR and first aid trained at least. Physical maturity assessment will be a part of like a pre-participation physical for a lot of kids. Their doctors should be checking them for this once they start to hit around preteen years, at least. Part of this is because so children are at a greater risk than adults for injuries in some ways. Due to their ability to assess risk, they're often less coordinated, have slower reaction times, and they're less accurate because their neurological systems are still developing, their motor systems are still developing. That's normal. And I mean, you can see that, you know, going to watch my son's soccer games it's just painful. I mean, I'm like, I could play better than that and I'm terrible, you know, but as they get older it becomes less painful to watch, right? And some kids are born with really high motor coordination. My son, when he was younger, was pretty advanced in that area, and as he's gotten older it's actually become more average. But some kids, you know, you just watch them play their sport and it's like they were born to play that sport. Their body moves exactly right to be able to play that sport. But that's not very common. That's why we notice it when it happens. Our rates of injury vary with age and gender, and injury rate is highly associated with the child's stage of development. So because of that, we really want to make sure that youth sports, to the extent that they can be, are matched by physical maturity, size, weight, and skill level. Most often, because it's an easy thing to measure, sports for youth sports are actually grouped by age. And kids develop at such different rates that can be a little bit tough. I mean, my son is at the higher age range in his soccer team, and he's average height to a little bit tall. And there's a girl who's literally a head taller than him in his class, and she can't be much older than him because he's toward the top of the age range. And you know, you'll see this a lot, especially when you start to get more towards junior high sports as well. You know, some boys will develop early and some won't develop until later, and she'll have the little teeny tiny kid who's clearly a kid still, and then another boy who almost looks like a teenager in a similar age group. According to the American Academy of Pediatrics, pre-adolescent boys and girls do not need to be separated by gender for sports activities. It's not necessary. The main strength differences that come from boys being stronger than girls, quote unquote, would be from testosterone, and there's a very small difference in the level of testosterone until they hit adolescence. So really, pre-adolescent kids don't need to be separated by gender. Separation of genders should occur in collision type sports once boys have attained a greater muscle mass in proportion to height. The reason that boys have a greater muscle mass than girls who weigh the same and who are the same height is not because the boy is just inherently stronger. It's because the boys have more muscle mass for their total mass. Remembering back to our body fat percentages, men will have less body fat than women do who are at a similar healthy range. So women just don't have as much muscle mass for being the same weight and height as a man. Not because they're weaker, it's because they just have more body fatness, and that's normal. If we look at a woman's muscle that is the same size as a man's muscle, it's going to have the same number of muscle fibers and all that stuff. That's not where the differences come in. It comes in that if we wanted to have a woman who is a similar strength as a man, she'd have to be heavier, basically. However, as far as gender equality goes, the other thing is with collision type sports, if there's not an equitable sport available for females, then usually girls will end up playing on the boys' team. For certain sports, it really doesn't matter. When I was working at UCSD, we actually had a guy on our field hockey team. He was a national level field hockey player, so he was really good, but he wasn't even really that noticeably much better than some of the best girls on the team. Being a man didn't really give him that much of an advantage, so he was allowed to play on the women's team. However, if it was rugby, he would not have been allowed to play on the women's rugby team because that would have been considered to give him more of an advantage as far as being a man. So again, this maturity assessment should be a part of the physical examination. And we use this to protect the physically young athlete. So if somebody is a lot smaller than other kids in their age range, then you need to kind of be aware of that and be careful with that. A commonly used tool for maturity assessment is Tanner's Stages of Maturity. So if you're really interested, you can look up all of the stages of maturity in the web link that's provided there. Stage 1 means that puberty is not evident. So that would be probably in like a 9 or 10-year-old. They're not looking like they're going to go through puberty quite yet. Stage 3 would be where they are going through mid-puberty. So this is our fastest bone growth, and it's crucial in terms of contact or collision sports because we have some growth plate weakness here. So that's our crucial stage of stage 3. And technically, that could be anywhere from 12 or 13 to 15 or 16 or even later. It really depends on the individual, but this is where we're having the most bone growth. And stage 5 would be full development. So for some people, they're not going to be through to full development until they're in their 20s. I just recently went to one of my high school reunions, and one of the gentlemen, Joey Langlois, looked exactly the same as he did our sophomore year of high school. It wasn't because he was aging well, it's because he was a full-grown man when he was 15. He just happened to develop really early. So, these people can go through these stages at different ages. As far as physical training and conditioning goes, these things are fine to do with kids. Kids can really benefit from conditioning and training as long as it's done safely. So guidelines and philosophies used by adults are not always appropriate for younger athletes. Kids are anatomically, physiologically, and or psychologically less mature than adults. So especially if we're talking about growth plate issues, we have to definitely take that into consideration as well. And also they may not be able to tolerate working out quite as hard as an adult can physiologically. Maybe their systems aren't as developed as an adult's are. Younger athletes should focus more on developing muscular strength, endurance, cardiovascular fitness, and flexibility. We don't want to be having very young kids doing a lot of powerlifting. So kids who are pre-adolescent shouldn't do that, a lot of powerlifting, because of the risk of growth plate and tendon attachment issues. So muscular strength is fine, muscular endurance is fine. We just want to be careful with doing a lot of heavy weight. We should really focus on form and general fitness for kids versus big increases in weight. And kids should work with fitness professionals, coaches, and or athletic trainers year-round to maintain fitness and nutrition. One of my biggest pet peeves with working high school football was when we'd get to double days and these kids would just be completely wrecked by starting 2-a-days after doing nothing all summer. And you could see it in their performance, you could see it in their recovery. They would get hurt all the time, and then I worked for 2 years at a private Christian high school, just mostly covering football, and they were good. They were a really good team. And I found out part of it was because they did summer conditioning. They were expected to do summer conditioning except for when they were on vacation. And because it was a private school, the parents were a lot more involved and they were able to get the kids there more. And this team crushed other teams in their division. They actually had to move up a division and start playing. This is a team here in San Diego. They had to start driving up to Orange County and to the Inland Empire to go play other teams in a higher division because they were just crushing all the San Diego schools. But it was just because of their conditioning. They had really great conditioning all summer. And then they would come into what they called Heaven Week because it was a private Christian school. And they did well, and they didn't have all these overuse injuries that other kids get because they were well conditioned for the activity they were doing. So the year-round fitness is important for kids who are going to be serious about a particular sport, at least by by high school or college age. And younger kids, general physical activity or staying involved in some kind of sport is helpful. As far as strength training, it's safe and appropriate for emotionally mature children that are able to follow directions in a properly designed program. So able to follow directions is pretty important. And younger kids can do calisthenics or bodyweight exercises if they're able to follow directions and perform the activity safely. I thought I'd throw this little picture in. This is a funny picture of my son when he was, I don't even know, maybe 15 to 18 months old and playing with my husband's little weights. Apparently, that is not how you get really muscular. Riding a weight like a choo-choo is not the best strength training strategy. But now that he's a little older, he can do calisthenics at least. But we don't have him doing a ton of weights. But you know what? He actually really loves, just using some small hand weights that we have in the garage, like little 2 to 5 pound hand weights. He loves those things. So kids can start to be exposed to these things from a young age. We just want to make sure that they're properly supervised and they're able to follow directions before they're using heavy weights where they can hurt themselves. We want to make sure that athletes are doing a conditioning program for about 6 weeks prior to beginning a daily practice routine. And we want to have appropriate warm-up with stretching and cool down with activities. For practices, we want to limit those to 2 hours max up to a certain age. So with littles, like when my son first started doing sports, he really maxed out at 45 minutes. He was not going to be paying attention past that. But as kids get older, they can tolerate longer periods of time. He's up to the point now at about 5 where about an hour would be good. If he's really interested in what he's doing, maybe an hour and a half, but really an hour is kind of his max at this age. As I get into older elementary, an hour and a half would be more appropriate probably. Some other concerns when it comes to youth sports would be psychological and learning concerns. Sometimes kids will feel a lot of stress from zealous coaches or parents. So I think it's really important when we're getting kids into sports that our philosophies as parents line up with the philosophies of the coach. And if they don't, we should probably find a new team. Children are usually eager to please adults, so that can make them vulnerable to coercion and manipulation. And sometimes they'll do stuff that they really aren't enjoying or getting anything out of personally, just to make the adults in their lives happy. As far as coaches go, it's really important for coaches to be positive and use positive reinforcement, especially with really young kids. This helps athletes to develop self-worth and self-esteem, which is a much bigger takeaway long-term than learning a sport. Most people will stop playing their sport by the time that they're in their early to mid-20s, whereas any self-worth or self-esteem they get from playing sports could last the rest of their life. As far as coaching goes, feedback should be given promptly after the attempt. So giving a child feedback a little child especially, feedback at a after game meeting is actually not super helpful. Ideally, they should be given feedback as soon as possible. If with little kids, they forget what they did, within like 10 seconds. They're fruit flies. With older kids, that might be helppful, but again, trying to address things as soon as possible so that the person can fix it is really helpful. Attempting to do your best must be emphasized. Now, obviously, as the athlete gets older, then they can be encouraged more with competitiveness and things like that. But with really small littles, attempting to do your best is really the biggest thing, because that again is going to help to build up their self-worth and self-esteem the most, versus being competitive and winning. And little kids don't necessarily understand that, so if they lose, they can be kind of crushed. I've seen a lot of little kids cry after they lose an event or a match. Children again should receive timely instruction, so as soon as possible after a mistake is made, they should have a correction. Not all children are equal in ability. Some children will respond to competition while others shy away, and it depends on what their understanding of competition is also. One time I was working a wrestling event, and the littlest kids I think were 5 to 6, and that was when I've seen the most tears because it's a one-on-one match, and then it's either there's a winner or a loser. It's not like you did your best, it's very clear. So this little kid, he was so funny. The other kid that he was wrestling against was actually pretty good, and he held his own. But this little boy had 2 older brothers who were also wrestlers, and he was, like I said, 5 or 6. He struts onto the mat, and he's showing his stuff, and he gets down in his stance, and he's juking and he's jiving, and it was hilarious. But he was clearly going to be good at what he was doing. The other child who was wrestling was actually pretty good too. He just probably wasn't as ingrained into the sport. So that the child who was clearly the born wrestler, who had probably grown up wrestling with his brother since he could walk, did end up winning the match. But again, he went in knowing that he was going to win, and he was up for the competition. Other kids aren't as much like that. We want to emphasize enjoyment of the activity, not just winning, but especially with younger kids. As far as other issues with psychological concerns, there can be an adverse effect of adult influences, which can cause negative psychological responses from kids. So we really want to make sure we're being positive as much as we can, both as parents and coaches. Participation in sports can be taken to extremes. Sometimes kids are required to have intensive participation as far as intensity and frequency. So, how hard they're practicing, how long, and how often can make a big difference in how a child feels about their sport. That places a lot of demands on the body and the mind. And if we're seeing some acting out from a child, oftentimes it's because they're having too many demands placed on them. Kids sometimes don't have the words to tell us they're feeling stressed, and so they end up starting to have behavioral issues. As far as ages 10 through 12, the children are going through a lot of cognitive development, and so that's when they're really able to start truly beginning to understand competition as an adult would, and being a part of a team. So we can start encouraging those thoughts earlier on, but if we really want to know when that child will really truly understand competition, it's not till they're probably 10 to 12. Because at that point they're able to comprehend multiple points of view, not just their own. Kids are little narcissists. Up until 10 to 12, they think their world revolves around them and theirs is the only point of view. And they can start to understand a team perspective, so they start to understand what being part of a team actually means, not just that they are part of a team. Another thing that could come up is if somebody has an injury, if a child has an injury and they're having to do injury rehabilitation, they could start to have some other issues too surrounding that psychologically. There are risk factors for psychological complications in injured kids when there's high stress in the family. If they have high achieving siblings, they're going to want to try to get back to doing what their brothers and sisters can do. If they have either over or under involved parents, that can cause an issue. They have a lack of leisure in athletics, so if they're not having fun, it can feel just like hard work, and they don't necessarily want to do it anymore, so they may continue to be injured past when they need to be, just because they don't feel like going back to sport. Another issue is just like with adults, their self-esteem can be reliant on their athletic ability, especially if that's their primary outlet outside of school. And again, if they have that narrow range of interests outside of athletics in school, then it's going to be even harder. So we really want to develop other things that our kids do besides just athletics. As far as coaching qualifications, I think that this is just kind of generally interesting information, especially if you have kids that play sports or if you will have kids that will play sports. There's currently no federal law that requires coaching education at any level. So technically, the coach that's coaching your children may have no training at all. There really were no real standards at all with coaching until about 1996, so it hasn't even really been that long. As far as coaching training, sometimes people will go through degree programs. They know they want to be a coach, and so they go through school as a kinesiology major with an emphasis on coaching and teaching. Sometimes people will go through a national body of sports certification program or youth sports coaching programs. That's great. That's really helpful if the coaches are willing to do that. Sometimes the coach is just a parent who's willing to help. So that's the other side of it. It's just because somebody's coaching doesn't necessarily mean they have any particular qualification to do that or any education in it. As far as the National Association for Sport and Physical Education, they have developed some national standards for coaches, so that's helpful. It's not a certificate program and there's not a single national assessment, but this group helps other organizations provide coaches with education, evaluation, and help with program design. USOC, or the U.S. Olympic Committee, also mandates participation in safety and first aid and CPR and AED certification courses for coaches that are functioning in their programs as well. As mentioned on the last slide, generally coaches have little to no providing safe and positive sport experiences. Most often they're selected due to availability or because of their previous experience with the sport, not necessarily with coaching. Oftentimes they're parents. Honestly, sometimes it's better when they're parents versus just a random person who's coaching because they have some idea of child development, possibly from watching their own child, but a lot of times they don't really have a lot of experience. Coaches need to understand child development on some level, as far as physical, emotional, and psychological development, to be able to most adequately and accurately communicate with those children. And coaches should be dedicated to the highest ideals of coaching. The National Youth Sports Coaches Association offers training for coaches and membership. So there'll be levels of certification, focus on coaching, safety and first aid, and the psychological aspect of sports. So even those parent coaches who are interested could look into different levels of coaching training to help them improve. And again, there are other coaching certification programs even outside of the ones we've already discussed. So there's the American Sports Education Program, there's a program for Athletic Coaches Education, or PACE, and oftentimes the national sport governing bodies will have their own educational courses as well. So say for instance the U.S. Soccer Foundation, or Federation, would have classes for coaches as well. So we are going to be talking about some common injuries in the young athlete in this lecture as well. Some of them will be similar to injuries we see with adults, but some of them will be specific just to kids and younger individuals. We do need to be concerned with repeated microtrauma that can become chronic or degenerative in the maturing musculoskeletal system. So we are going to want to be aware of that when it comes to repetition of throws, say for instance for baseball. And again, children are susceptible to similar injuries to adults, but also more susceptible for certain injuries, especially arm fractures. So this little guy in his cast is really cute, but we do see a lot more casts with little kids because they tend to fall more off of step stools. Just kidding. Okay. So one type of injury that's very specific to kids or people who are still maturing, so maybe even possibly up until in the 20s, but usually this is in younger kids, would be a growth plate fracture. So the growth plate is the region at the end of the long bone where bone growth occurs. So in this x-ray, we can actually see the growth plate as a white line right here. That's an area of bone growth activity. That growth plate determines the length and the shape of the bone. So if it's disrupted, then that can cause a problem with those things. Trauma to the growth plate can be acute or chronic, or it can be from overuse or stress in general. A suspected fracture should always be referred to a physician, and then the physician will determine the severity and the form of treatment or immobilization. So in this particular photo, this is showing this little growth plate fracture right here. That's a decently displaced little fracture. So the treatment for this one was actually going in to put a pin in there to hold it in place to make sure it was more stable. The issue with the bone growth plate fractures would be that the bone will either stop getting longer or have stimulated growth, with the injured leg becoming either longer or shorter than the uninjured side. So if the bone stops growing, then that leg is now going to be shorter than the other one always. Whereas if it gets overstimulated, it will become longer. We have different ways to deal with that, but it's not ideal. We prefer as much as we can for our limbs to be similar length. Complicated fractures must be followed up until skeletal maturity is reached, so they'll have continued follow-up with their doctor to make sure that they're not having any problems with that growth plate. I got pretty lucky with my son when he had his wrist fracture. It was not over the growth plate, but it was darn close. Within probably, just maybe half to a quarter of an inch. It was really close. Another type of injury that we see commonly with kids would be an apophysitis. So we can get these at the knees. So that's Osgood Slaughters. That's another picture of Osgood Slaughters we talked about before. And we can also get it at the heel. So at the heel, it's called Seaver's disease. But basically, the apophysis is a specialized area of cartilage within the growth plate, and it's often near an attachment point for a large tendon. So say, for instance, at the tibial tuberosity and at the calcaneus, where the gastrocnemius and soleus attach. Repetitive stress here can result in an inflammatory response, and then we'll get swelling and irritation at that area of attachment, so like with Osgood Slaughters and Seaver's. These will usually begin in the age group of 8 to 15, so when we're having the most growth. And usually pain will be with activity. Tenderness is localized with no other significant abnormalities, so they're going to have pain over one spot. They're not going to have pain in their whole leg, say, for instance. They'll be diagnosed with this from their history, physical exam, and occasionally from x-rays. Sometimes we can see these things really well in x-ray. These aren't serious, but they can lead to more serious injury if they're not treated, and these will resolve over time. Mostly we just need to reduce their symptoms. If we have somebody playing, though, who has either Osgood Slaughters or Seaver's, and they keep going, then they can start to cause basically a peeling off of a piece of the bone. The tendon starts to peel off a piece of the bone, and it can cause an avulsion fracture, and that is more serious. So we do need to treat these. It's not that we can ignore them. It's just, again, usually they're not going to be casted necessarily or something like that. Speaking of avulsion fractures or peeling off of the bone, this has a lot to do with bone versus muscle development. Again, sometimes their bones grow faster than the muscles during periods of fast growth, so that can cause an imbalance and possibly injury. So this is a picture of having an avulsion fracture where a piece of the bone got pulled off the tibial tuberosity. But this can occur in lots of different places. It doesn't have to just occur from having Osgood Slaughters or Seaver's. The stress is placed on the bones through the tendon of a contracting muscle, may result in pieces of bone being pulled away from the point of insertion, and it can happen where any really large muscles are attached possibly. So common sites would be the ASIS up at the hip, where we have our hip flexors attaching, the AIIS, where the rectus femoris attaches, so this would be common maybe in soccer players who are kicking a lot and bringing that leg back and then coming forward. The ischial spine, so our sit bone, where the hamstrings attach, and the fifth metatarsal, where the peroneals attach and can pull hard. These are much more common in the lower versus the upper extremity. In fact, I wouldn't expect to see these in the upper extremity unless we're talking about a gymnast or somebody who is doing a lot of impact with their upper body. As we talked about in the lumbar spine lecture, we can have a spondy in even young kids because it can be a congenital issue. So our spondylitis, spondylolysis, or spondylolisthesis, these are a defect or possibly fracture of the bony structures of the spine. Usually this occurs with repetitive loading. So gymnasts might be more predisposed to this. So the repetitive loading could be like pounding, or repetitive extension tends to be more commonly what's causing this. This can occur between the ages of 5 and 10, and it's usually around the 4th and 5th lumbar vertebrae, or it can occur when the person's older as well. Children often remain asymptomatic, and the injury is not realized until later in development. The way that we would figure out what it was is we'd have to have x-rays to determine the extent of the injury, usually from a very specific view. And treatment will be focused on healing of the defect and treating the patient's symptoms. So it really depends on the physician's decision and what they're seeing on the x-ray. Sometimes kids will be braced. Most of the time that braces aren't necessary, but flexibility is a big thing with kids. In addition to trunk stability. So we need a lot of flexibility with the hips and back muscles, and just like we discussed in the lumbar lecture, doing a more flexion-based or abdominal-based program would be more comfortable for these people instead of having them going to a lot of extension. As far as sports injury prevention, all individuals involved in sports, a primary goal should be prevention of injury. So we do that by properly physically conditioning and psychologically conditioning the athletes, even the little ones, using appropriate equipment safely and a safe environment with adequate supervision. So it's important that kids are using appropriately sized gear. So if a child is wearing a helmet that's too big for them, it's not safe. Just like you wouldn't want somebody running around in shoes that were 3 sizes too big for them because they would trip. And they need to be adequately supervised. Part of that is making sure that we're enforcing safety rules and making sure that participants receive a physical and are cleared to participate. So far I've been yet to have somebody ask me for a physical for my son, but I'm sure it's coming soon. He's still pretty little. And then we want to work with athletes on acclimatization and hydration status. Last but not least, as far as our youth athletes are concerned, we want to make sure we're instructing participants on fitness and the various components of their sport to the extent that we have knowledge, keeping in mind performance enhancement and injury reduction. I think strength and conditioning is great for preteens or even just slightly younger kids. I think it's really helpful as long as we're doing that appropriately and using appropriate weights and reps and rest times. We want to encourage proper eating and nutrition, and be sure that we have plans and guidelines in place regarding care and treatment of injuries, so an emergency action plan. We want to work to create a safe and healthy playing environment for all participants, and be aware of injury prevention guidelines for specific sports. And that is the end of our youth sports lecture.